Hello, I'm Dr. Manish Singhal, medical oncologist at Apollo Hospitals, Noida and Delhi. We are presenting the ESMO update meeting. ESMO is European Society of Medical Oncology meeting, which was held this year in October 2023. This is a meeting which is attended by global experts across the world, and it provides all the up-to-date information about various cancers. And we are happy to announce that this meeting was held under the aegis of Apollo Hospital and was held on 4th of November at Radisson Blu, Sector 18, Noida. And we were able to invite faculty across Delhi NCR and all other cancer experts, which shared their views on these updates, and was attended by a lot of students. And I'm sure that these updates includes not only about breast cancer, lung cancer, GI cancers, gastrointestinal cancers, GU cancers, but also supportive care and sarcomas. It's so very important to keep up to date to provide the best possible care to our cancer patients. And I hope that you like these updates, and we will keep introducing more updates like this in the future. Thank you.
Dr. Abhishek Shankar is a radiation oncologist at AIMS, New Delhi. So he'll be talking on the topic.
So I'm Dr. Abhishek. I will be talking about a very important study which was published which was presented in ESMO, and it has really attracted so many people. And living in Delhi with this much of AQI, it had so much of significance. We used to talk about this AQI, different components in terms of lung cancer, but to your surprise, now we know about breast cancer, but apart from this, it has so much of significant value in terms of pediatric cancer, leukemia, hepatocellular carcinoma. This is not, now we need to think about it. Where is the PPT? Are you playing? Okay. So we need to talk about this. The study was published, presented. Okay, right, Okay, so I will be presenting the long-term residential and workplace exposure to air pollution and breast cancer risk. This was the first case-controlled study nested in the French E3N cohort from 1990 to 2011. So the objective was to investigate the association between breast cancer risk and long-term particulate matter, which is 2.5 PM10, and nitrogen dioxide, which is both three as an important component of AQI. Atmospheric concentration 1990 to 2011, estimated at a fine spatial scale 50 meters into 50 meter area at women residential and workplace locations. So the study design, they used the case control data for the French national E3N cohort. So what they did, they took age group 40 to 65 years at inclusion in 1990 in the metropolitan France, and they collected the information using a periodic questionnaire regarding socio-demographic profile and anthropometric medically confirmed invasive breast cancer cases diagnosed between 1990 to 2011 in this particular cohort. And they did a matching one by one based on, to match the department age group, date of inclusion, menopausal status and inclusion, and availability of biological samples, blood or saliva, with 2984 control, which was randomly selected by the incidence sampling. So the aim was estimation of long-term PM 2.5, PM10 and N2 level, which they measured, and they just correlated with the breast cancer incidence. So history of residence and workplace location collected through a specific question, and in this particular cohort, the response rate was 69%, and complete residence and workplace history was given by 69%. They did the geocoding using the address from the French National Geographic Institute, and they used the land use regression model. This model is basically based on, estimated population, pollution estimate in that particular area, and which also, this is required to link other environmental factor, which is important, characteristic, which is linked to the pollutant emission, and at the same time, which is important in efficiency, So they use the, around the 50 into 50 size, and model validated using monitoring site using hold-out validation. What is hold-out validation? When you take the data, you divide into the multiple parts. One part of the whole data is used to, do the training of the model. So this is totally, I think, AI modeling. And other part is used for the validation and testing of the data. So the average of the annual mean concentration from 90 to the index date was calculated for each pollutant separately for women residence and workplace location. Weighing of average pollutant concentration by the proportion they spend the time 20% at home and 80% at home and 20% at workplace. So the result, association of breast cancer with average of the annual mean, you can see PM 2.5 case and control. In the model 1, they decided to the normal, what's in the study, and they in model B, they also use all other confounders, which is important for the risk factor for the breast cancer. You can see the model A and model B. The odds ratio is 1.28. That means there is a statistically significant increased breast cancer risk for a 10 microgram per mercury increase of the, almost 28% increase. So this is association between the breast cancer and PM 2.5. No difference by hormone receptor status, nor effect modification by the menopausal status was observed. So to conclude this study, this was the first investigation which is, finding the causal relationship between the breast cancer and long-term exposure of the air pollution, particularly the particulate matter 2.5, and this has a history of 22 years of follow-up. There was a positive association, statistically significant, between the average of the annual mean PM 2.5 concentration and risk for breast cancer. So findings were comparable when using only concentration estimate at the resident and when increasing proportion of daily time spent at the workplace, both for the resident and the workplace. So the perspective is we need to have future studies, and probably when we are India and in Delhi, probably all the studies which have been done in the past, whether it's California, Canada, Taiwan, they have, apart from this, many of the studies has also shown association between the nitrogen dioxide, PHA, and these are the various. You will find many of the studies they are planning. We have authored for the lung cancer, total for the total cancer and the air pollution risk. Now we are doing the systematic review for the breast cancer and the air pollution. So these are the studies which has already been published before that, but this has the longest follow-up. So this study, anybody can read it, and I think we have published this, but nobody can open it because it's a paid subscription. Even this is the very irony that I have written an article and I can't read it by myself because it's a paid article. So we have described it, all the study for the, you can read and understand how these two things are correlated. But I'm skipping there, but this is a paid subscription. Anybody has the paid subscription, they can read it. Thank you so much for this. And I think we need to all work about this. Otherwise, Manish sir is very passionate about air pollution and cancer risk. Now it's time for action. And thank you, sir. During the ICC, you only have the courage to organize a conference in Delhi.
So I think many breast cancer patients come and they ask us, what is it? Why did they have it? This is one of the reasons we can quote now. We have studies over it and you can tell now it's one of the risk factors. And if you look at the air outside, it's killing.
Demographics of breast cancer.
It was standard teaching that breast cancer in the urban population is higher, whereas in the rural population breast cancer incidence is lower. So that difference is gradually not that much there. One of the reasons as well be this. I mean, it's not the sole reason, obviously.
I'm so much worried about the multiplicative effect of air pollution on other risk
factors. The smaller towns are also now becoming terribly polluted as far as atmospheric pollution
is concerned. I think the
concerned.
most polluted place is not Delhi, it's some district in Rajasthan.
Ghaziabad is considered to be the most polluted.
I think, sir, as per the AHQ, which is from the Geneva, I think every year it changes. It was Kanpur long back, and they see overall per year the mean for the average mean for the year. So at one point of time, Delhi was polluted. And I think wherever they have now installed the measuring machine, everybody is now on radar. So now, out of 6 most polluted places in the world, out of 100, we have 61. We have improved from the last year. It was 63 last year. So I think from China, we have envy of China. Now we are the most populous and the most populated. So probably it comes with a very heavy disease burden, especially for the cancer. So as a cancer specialist, probably we should focus on immunotherapy, but this is the area. And I think now I can see the cancer incidence is rising in the colleagues who are treating cancers. So this is one of the risk factors. And the non-smoker. So we have few of the colleagues diagnosed with cancer and they're non-smoker, they have no risk factors. But now if you are living in Delhi, you can't say you have no risk factors. Risk factors, roaming with you 24/7. So thank you so much.
Very interesting.